I'm the founding director of the Brain and Mind Institute. For those that are not aware of this institute, this is newly minted institute. We're only about 4 years old, with a focus on brain health and mental health. And as you know, recently we just commemorated the Brain Awareness Week, and today's webinar uh, is focused on understanding dementia, which is a brain illness in Kenya. And so why is this an important topic right now? And the answer is that people are aging more normally now in Kenya because we've got many communicable diseases that have come under control. We are projecting an over 300% increase in elderly population of Kenya over the next few years and by 2050. And this means that we are going to be seeing a lot more of dementia coming our way. For those that have not already been exposed to it, uh, one way or another, you will get exposed to it because it's the next pandemic coming. Um, I didn't want to take up too much of your time, but just to let you know that I wanted to essentially just to welcome each and every one of you and our panelists and for today's webinar. And this is a part of an initiative to increase awareness of brain health. It's so important for us to be focused on the health of our brains because the brain that you're born with is the one that you're going to die with. And all the wear and tear that the brain experiences through your development, through your life cycle, it's very important to pay attention to it and try and keep your brains as healthy as you can because you don't want to end up with mental ill health or brain ill health, which might come your way. A lot of it can be prevented. And so you learn a bit about the genesis of dementia in today's webinar. Um, and without further ado, let me introduce our moderator, Dr. Karen Blackmon. She is a neuropsychologist. She's a star researcher at Brain and Mind Institute, but she also works at Dartmouth University. She's a board certified neuropsychologist, and her research is very interesting. It's focused on developing appropriate tools that that are contextually sensitive in the low and middle income countries, because some of the tools that we have inherited from the global north are not necessarily the best tools to detect and to assess dementia in our population. So this is an area that she's very passionate about. And she's well published and well funded researcher. So we're very proud to have her with us. So without further ado, I'll pass it over to Karen, who will then introduce you to the other panelists. So welcome one and all. Thank you.
Thank you, Dr. Zool, for that introduction. I'm very pleased to be here with this esteemed panel of colleagues and peers who are all doing innovative work to change the landscape of dementia prevention and care across the world, but especially in Kenya. So first, I'm introducing Dr. Jacqueline Theru, who's a brain imaging expert. And she's also someone who has lived experience of caring for a loved one with dementia. So not only is she advancing the science and care of people with dementia by understanding how it looks on brain imaging and how we can better diagnose and detect dementia early so that she can help families cope and understand how it progresses over time and what to expect. And she's someone who does that from a place of compassion and care, of having lived and loved and cared for someone with dementia. So we're very fortunate to have someone with her multiple perspectives here with us today as a panelist, and welcome. Next, I'd like to introduce Dr. Sylvia Mbugua, who we have been so lucky to work with across our dementia studies. She has been leading the neurology care of patients with dementia, including those who have dementia due to stroke or people who've lived with epilepsy. She's the section head of neurology at Aga Khan University, and she works to improve the overall quality of life of people who are living with neurologic conditions. She understands that it's not a death sentence to have a neurologic diagnosis. You can live very well, and she helps people do that and helps us understand. So welcome, Dr. Sylvia. We're very happy to have you here. Next, I'd like to introduce Dr. Edna Bosiri, who's a medical anthropologist and has pioneered the community understanding of attitudes and beliefs around dementia. She has been working with Brain and Mind Institute from the very beginning and establishing the methodologies of the Brain and Mind Institute to work together in partnership with communities so that the research is informing questions people want to know more about. She has done a lot of work interviewing both patients and also physicians. So she understands not only the community perceptions of dementia, but physician perceptions of dementia and where we're going next in dementia care and treatment in Kenya. And finally, I'd like to introduce Dr. Vaibhav Narayan, who is the Executive Vice President and Head of Strategy and Innovation at the Davos Alzheimer's Collaborative. They have been funding our work in Kenya from the beginning and helping build an research infrastructure, not only in Kenya, but across 7 different countries in the world to innovate and harmonize dementia prevention, research, detection, and care. He's doing work or leading work in Kenya, in Chile, in Colombia, in the US, in Egypt, in India, and South Korea, so that we can align our work with global approaches and make sure that Kenya is benefiting from advances in dementia care. So welcome, Dr. Vaibhav. We're very fortunate to have you here, and I'm excited to dive into this conversation with the panelists. Just to let everyone in the audience know that we will be doing a question and answer session at the end. So we'll have at least 10 minutes to hear from you after we discuss with our panelists some important topics in dementia care and research. So starting with Dr. Bosiri, Dr. Edna, as an anthropologist, you've spoken with people with lived experience, physicians, family members, caregivers. You've basically talked to everyone. Can you help us understand what you know in terms of highlights from the studies you've done on dementia in Kenya, some of the dominant perspectives, and what that means for policy and practice?
Thank you so much, Dr. Karen, and want to thank our audience for tuning in. And today we'll be talking about the work we did here at Aga Khan University Brain and Mind Institute on dementia, attitudes and perceptions and lived experiences, the work that was funded by Davos Alzheimer's Collaborative. So we were able to talk to 26 patients seeking care at the Aga Khan University Hospital and also 36 of their caregivers. We were able to talk to 21 healthcare providers. This includes neurologists, psychiatrists, speech therapists, and other care providers who interact with these patients. Then we were also able to go to the communities in Nairobi, that is Mathare and Kibra informal settlements, to talk to community members and understand what do they think about dementia, what do they know, and what do they, their perceptions and so on. So from the patients that we were able to interact with, most of them were aged between 70 to 80 years old, and most of them actually they did not even understand that they had dementia. There was that lack of understanding of dementia. So there were some characteristics that we learned that caregivers and their loved one had observed, such as forgetfulness, persistent forgetfulness, people sometimes becoming agitated and so on. And so what they mostly their loved ones thought about, it was like a normal part of aging. So people did not take any action earlier because they felt it was a normal part of aging. And sometimes when they started exhibiting some characteristics that, like wandering around or things that could lead to stigma, so some of the caregivers would, take these patients, lock them sometimes at home without really allowing them to come out. Some of them did not even speak about what their loved ones were going through to their neighbors, to their friends, something that put these people earlier in isolation instead of letting letting them out or helping them access care in the hospitals. So another thing that we found from the patients, some of them access care much late. There was delayed care seeking because, as I mentioned, there was lack of understanding that this is a condition that someone can get help at the facility earlier, but also there's stigma at the community. And the first action point for people was to access care in primary healthcare facilities. And we know in our primary healthcare facilities in Kenya, we don't have the capacity, we don't have human resource to be able to screen. We don't have experts in these facilities. We talk about Aga Khan University Hospital, which is a tertiary level. That is where you can find neurologists. But at primary healthcare facilities, we don't have these people. So people start accessing care when they are really progressed already. So that was one of the things that we observed from the participants we were able to speak with. And so another thing we learned is that the cost of care for dementia is quite expensive. You can imagine doing brain imaging and lab tests. Before neurologists do a diagnosis, there are a number of steps that they have to follow. And that is something that we found was really a challenge to the patients and to the caregivers. And speaking to the caregivers, also, most of them did not understand what dementia was. So they turned into internet and starting to look for information based on what they were observing, how their loved ones were behaving. And so because of this, they did not even anticipate that these patients will deteriorate further down the line. So they thought it's something, maybe forgetfulness, it will end up there. But then things continued piling up, which was a problem because it became a financial crisis. It became something that impacted the caregivers in terms of, cost, but also in terms of emotional and even the physical aspect. So there was caregiver burnout taking care of these patients. Some of the caregivers we spoke to actually sacrificed their jobs to take care of their loved ones at home. We had people who could not even get married because they said, I have to be here with her or him to take care of them. And what we found again for the caregivers, majority, that is 80% of the 36 caregivers that we spoke with were women. So you can imagine the caregiver burden to women, because in our context, actually, there's that caregiving and nurturing aspects delegated to women. So the women were the ones who are mostly taking care of these caregivers. And later, maybe as the panel discusses, we'll see what is the implication when we have the women now going through this caregiving burden, most of them, again, being the people who have deteriorating, like dementias and so on. What does it mean? What is the policy implications for such? And so, although some of the caregivers had devised coping mechanisms, such as, being prayerful, turning to religion, speaking to family support, and also the support they received here at the Aga Khan Hospital, really trying to help them cope through. But there was kind of a learning process throughout the whole journey to see that the patients were supported to be able to navigate through these conditions that most people did not understand from the beginning. Then out of the healthcare providers we spoke to, these are the providers who are working here at the Aga Khan University Hospital, and very few people have access to such providers. But what they told us is that, there is no proper clear pathways for dementia care in the country. So patients were referred from either by friends or from other public hospitals to access care at Aga Khan. And also, what they told us, what we saw, and we also observed in the clinic, is that they do really a very good job in characterizing the patients. They follow WHO or world standards in terms of, history taking, doing physical cognitive assessments, doing brain imaging, and so on. Something that is really good at the Aga Khan University Hospital. But what they told us, this is not a replica of what is happening in our public hospitals. So in our public hospitals, maybe lack of equipment, lack of enough specialized trainees, specialized like neurologists to take care of these patients. That is a key gap that we noted from the healthcare providers. And also they told us, they echoed what the caregivers and patients had talked about. The care is quite expensive. So if there's something that can be done in relation to caring for these patients, especially if care is tackled earlier enough before patients are really progressed into the journey of, becoming demented. And lastly, what we did, we spoke to the community members. We went to the community to see what people think about dementia. People talk about forgetfulness. In Kenya, they say kusahau, like persistent forgetfulness. But people think it's not a normal part of aging. So they don't see it as a big problem because they assume that as everybody grows old, they will end up behaving the same way. But we know not everybody who grows old gets dementia. And we know that dementia is not, healthy brain aging. So that is something that we found. But there is also stigma as I mentioned, when communities see some behaviors that are not socially acceptable, then they end up locking patients, trying to isolate them from the community members and so on. And people are not willing to talk about it. So we asked community members, will you be willing to participate in dementia research, for example? And if so, maybe dementia research, for us to understand the risk factors, there's need to take biospecimen, biosamples like hair, like blood. We asked them, will you be willing to participate, to give out those samples? And what we learned, community members are quite hesitant to give some biospecimens such as hair because of cultural reasons, because people believe that maybe you use hair, you are going to use it for witchcraft and other, cultural practices. And when we ask them things like saliva, although they are willing to, because saliva, they say it's an easy sample to provide, but it's something that communities are not aware that this can be a sample. So there's need for more awareness creation. There's need for more, educating the communities about dementia and how the research for dementia is conducted, what sort of biospecimen needs to be provided, and so on. So in summary, these studies and what I've done with my team here at the Brain and Mind Institute really speaks to issues around awareness creation in terms of policies, both in our communities, but also to support families that are taking care of these patients, especially caregivers. They also need to be trained. And we need to really, as we continue the discussion, I would like to see more, more actions around policies in relation to care, care packages in terms of payment and cost for dementia patients in the country, as well as training neurologists. We have only about 18 neurologists serving 56 million Kenyans. That is a huge gap. So you can imagine how many people are going to really get in touch with the neurologists. Very few patients. And dementia is real. Dementia is in our communities. We have people who haven't had an opportunity to meet the neurologist, but there's a lot to be done, a lot of policies that I think I will come back to later and together with my panelists. Thank you so much, and over to you, Dr. Karen.
Thank you, Doctor. And I'm really hearing you emphasize just how much of the burden falls on the shoulders of caregivers without access to early diagnosis at the primary care level. Families are left on their own to figure out what's going on and to even combat stigma in their own communities to protect their loved ones. So I want to ask Jacqueline a question about that challenge for caregivers and whether you have some advice on how to strengthen the resolve and resiliency of caregivers.
Thank you so much, Karen. Caring for a loved one with dementia is an incredibly emotional journey. It's a journey filled with love, a lot of love, heartbreak, and sometimes an overwhelming sense of helplessness. One of the biggest challenges caregivers face is the emotional and mental toll of watching someone they love slowly fade away. And I must emphasize that most of the times it's a very slow fade, and especially when it begins early on. I mean, Dad was only 54 years old when we noticed the first symptoms. And at that time, we thought it was normal. I mean, he had just hit the big 50 and he would be fine, also we thought. It's painful when a parent, a spouse, or a grandparent no longer recognizes familiar faces, struggles with the basic tasks, or even becomes frustrated and confused, among other challenges that present along the way as dementia progresses. Caregivers often experience deep sadness, exhaustion, and even guilt, and sometimes even question if they're doing enough, if they're being patient enough, if they could have done something differently. All these things come up in the process. And beyond the emotional strain comes the financial burdens. Dementia care is long-term and very costly, yet many families lack the resources for professional support. The fear of leaving a loved one alone, even for a moment, can be overwhelming, yet finding help is often a privilege many cannot afford. The lack of awareness, again, and stigma surrounding dementia means that caregivers will feel isolated with very little understanding and help from the communities. Because these are the same communities that bring in the stigma, and it's because they're not aware. Caregivers give so much of themselves, but they cannot do it alone. They need support. They need understanding and the resources, not just for their loved ones, but for themselves as well. I think raising awareness, improving healthcare access, and fostering a community that acknowledges their struggles, I think can make a world of difference. Thank you, Karen.
Thank you. That makes it very real for us to hear your experiences. And for someone like Professor Vipov, who works with the Davos Alzheimer's Collaborative and are trying to tackle these issues on a global scale, when you hear these stories at the level of even the personal, how is your team at DAC innovating strategies across the globe to tackle the lack of access to early detection of dementia and awareness of how dementia progresses?
Thank you, Karen, and thanks for inviting me to this wonderful webinar. I just want to, first of all, also thank BMI and AKU for the wonderful partnership that they have with us. Karen, you've been, and Edna, you both have been integral parts of it. I do want to come to the answer to your question, Karen, but wanted to highlight that what Edna has said is quite crucial, and I want to congratulate Professor Zulmirali for his foresight that when we started doing as DAC our work in Kenya, we wanted to focus on technology. We wanted to focus on uh, early detection and diagnostic methods. But he made it very clear that for any of these efforts to really bear fruit, we had to take a community first approach. We had to take what he calls a living lab approach and really understand how the community members would accept and react to various approaches of tackling dementia. And from our perspective, as you know, in the global north or in high resource countries, the approach that has been taken for most diseases, including dementia, is a very resource intensive one. It involves very expensive medications. It involves a highly trained and specialized clinical workforce, which is quite expensive. And when you look across the world, one realizes that these resources are not readily available, right? Edna, you mentioned the low density of neurologists available in Kenya. So in terms of innovation, I think the very first thing we need to focus on is the community. How can we really turn uh, Alzheimer's prevention and treatment into a public health approach rather than just purely a clinical approach? How do we really empower the community members and caregivers, give them the right training and tools to turn them into our frontline allies? What can we do to help reduce burnout in caregivers? What can we do to give them appropriate training to tackle the substantial behavioral and functional issues that their loved ones face? And my hope is that over time, countries like Kenya will, in fact, lead in this space. They will show to the world what's possible by taking a community first approach where community health workers, caregivers, both familial and professional, are playing a frontline role in tackling dementia. So that's the first thing I wanted to say in terms of global innovation, more of a public health and community driven approach. The other area I would like to point out is technology, right? Um, Early detection and prevention enabled by mobile health and digital technologies could be another area of global innovation where Kenya could lead. Kenya is a young country with a median age of, I believe, only around 20 years. And increasingly, most young Kenyans will have access to smartphones and internet bandwidth. This will allow Kenyans to adopt and develop digital health solutions for tracking brain health, for detecting cognitive decline, and even delivering interventions that promote brain health, increase brain resilience, and prevent cognitive decline. For example, in our collaboration with BMI, we are working on speech-based biomarkers, where our long-term vision is that just by a phone call and collecting speech samples over a telephone, one can detect early cognitive decline that's not due to normal aging. And this could then result in some awareness, some risk factor awareness, and potentially some prevention paradigms being pushed out also in a telemedicine format. So in short, what I would say from my perspective, from DAC's perspective, that in Kenya, we could really focus on innovations that are related to community-led interventions and technology-enabled solutions for dementia prevention and care.
That's really key. We've learned from our research that people are coming to the hospital too late, that it's too late in the dementia process. There's so much that could be done earlier on, but people aren't coming earlier because they're, first of all, not sure, is this normal aging or is this dementia? And second of all, well, what could be done? So Dr. Sylvia is here with us today, and she is someone who's taught us just, how bad that problem is, that someone is not coming or bringing a family member to the hospital until it's too late. So how can you speak to, some of the challenges, Dr. Sylvia, that you face in raising awareness and in the clinic of helping people get care sooner?
So good afternoon, all. And it's my pleasure to be here today. Can you hear me? Can all hear me?
Yes, we can hear you well.
Okay. I just want to thank Edna and team for this particular research. It's been mind-opening even for us who are in the field of dementia. And yes, you're right, Karen, that a lot of our patients are actually coming to hospital pretty late. Dementia is not part of normal aging. Normal aging is where we want to see our old patients, our elderly patients, our geriatric population being able to stay at home and be able to carry out the activities of daily living and also do things for themselves and not have to forget their way home or forget how to interact socially with their colleagues and people who they go to church with. So dementia has become, I would say the prevalence has increased, and in one way or the other, probably because now we are seeing more of the aging population, but also because now there's increased awareness. So people are beginning to realize that dementia is not part of normal aging, and they are now bringing their loved ones to hospital to seek medical attention. The only catch here is that they wait until it's too late. We've had several talks and several webinars, and I also talk to my patients in the clinics that by the time dementia comes to the attention of family, that particular patient has probably had this cognitive decline for 2 years before it comes to the notice of the patient, of the family and the relatives of the patient. Why is this so? Most of our patients are actually very high achieving individuals. Many of them have been bankers, they've been teachers, they've been lecturers in universities. So by the time they start to become forgetful, they already start to organize themselves. You'll see the ladies putting little sticky notes on their fridge doors, on their walls, their bedside tables. Remember to buy vegetables. They start to put their keys in particular places, and they start to do things in a particular way that they never used to before. They start to forget their banking PIN numbers, but they are able to manage without bringing it to the attention of their loved ones because probably they are in denial themselves. And secondly, because they probably do not want to worry their family members too much. So by the time a family member, probably who does not live with the mom or the dad, comes to realize it's when they come to visit that once in 2 months or once in 3 months, because face it, Kenyans have now joined the Western world. We become a very busy population. We're running everywhere. So we probably don't have time to visit most of our loved ones who live up country. And by the time you go to visit them in about once or twice in 2 or 3 months, you find they've already decided to become forgetful. And by the time you talk to each other and you decide to bring your loved one to the hospital, it's now progressed. So dementia is something, as Jacqueline has said, very emotive, and it actually touches on the core of dignity of that particular family member's life. They will forget how to dress. They will forget how to cook. They may forget how to clean up after themselves. They forget how to dress themselves up. They might put on their clothes inside out. they forget how to become have behaviors that are socially acceptable in terms of interaction with people in their social gatherings, be it in their meetings, be it their church gatherings, family meetings. So it really touches on the core of human dignity and the core of the persona of who you are. So you find that most of the patients now begin to become very withdrawn. They want to stay on their own because they don't want to go out in public where they will keep on being asked, don't you remember my name? We met in such and such a place. Don't you remember? So it becomes traumatic for them and they want to remain on their own. Yeah. And as Vaibhav actually said, rightly so, that now we need to look for biomarkers and ways of picking up dementia pretty early. Part of it also comes with community awareness. There's also a lot of stigma surrounding dementia. Many people, when they find their loved ones have dementia, they want to keep them hidden at home because you'll find that they are not being socially, they don't have socially acceptable behavior when they're in public. So they would rather deal with their loved one remaining indoors where nobody else has to know that their mother or their father or their loved one has dementia. So we need to go out there, have public awareness campaigns, do more research like what Edna and team, and they have involved me and the rest of the neurologists that we work with in the Aga Khan, that we need to create awareness that dementia is an illness and that you can seek help early, and that it is crucial to know that the medications that we use right now available in our third world and second world countries slow down the process of aging and they slow down the progression of the dementia, but will only be useful if started early. In the West, there are other drugs that have come up. They are what are called the anti-amyloid beta deposition drugs. These are the ones that now, because two proteins have been identified, beta amyloid and the tau proteins. So these medications, what they do, they're actually the biologics that help to reduce the deposition of beta amyloid in the brain tissue around the neuronal networks. And so they actually try to see whether we can, to some extent, reduce the development of dementia and slow it down. But again, these treatments need to be started early. So again, early diagnosis and detection of dementia is crucial.
Thank you so much, Dr. Sylvia. What you said has probably made lights go off for many people. The terms are hard to learn in the beginning, but what you're pointing out, these are actual pathologic proteins that are causing problems in the brain.
Yes.
That it's not part of normal aging. And that these proteins, the beta amyloid and the tau, they can appear in certain parts of the brain. Tunasema kusahau, forgetting. That's one part of the brain, but there's others. So we have audience members that are asking, what other indicators are there? And I know we're going to get to the Q&A at the end, but since you're talking about this and it's so important, other than forgetting, what other parts of the brain do these abnormal proteins prefer to aggregate and cause problems that we could see in people's behavior and family members could recognize as something that's not normal aging? What have you seen in your clinic that could be clues for family members that's not part of normal aging?
The biggest things that come to the forefront is actually personality change. So you'll find that someone who was previously very calm, able to be in charge of their day-to-day life activities, able to interact with family and friends and colleagues at work, begins to change in terms of personality. So if someone is very calm, they now start to become pretty aggressive, and they also become very defensive because initially they have insight. They do realize that they are becoming forgetful. Things are no longer the same, and they get tired of everybody, family members constantly asking them, we had this conversation a few days ago. Don't you remember? You keep on losing your keys. Where are your keys? You keep on losing your money. Where is your money? So in the beginning, they become very defensive, and it's a very self-protective defense mechanism. Later on, as they begin to lose insight, the defensive nature now really trajects slowly into aggressive nature. Some of them could become outrightly violent with their family members. And this is something that the families really find it difficult to contend with. You have your dad or your mom who's very loving, and suddenly they're very aggressive. You ask them questions and they answer out of context. For instance, you might ask them, today, where are we going? Like they come to the hospital, they're brought into the clinic. And I've developed the art of, you have to talk to them because a lot of our patients with dementia will still retain some insight. Just like every other person, they will have their high days and their low days. So there are days when they seem to remember everything, and the family members are very encouraged that we're getting mom back, we're getting dad back, we're getting our uncle back. And there are days when they are really low, they can't remember virtually anything, they will misplace everything, they will lose their way away from home. If they leave home, they can't find their way back home. And that sets the family back into depression because it's a yo-yo, it's back and forth. So they start to change in terms of personality. They also begin to lose their way. They cannot manage their financial affairs. You realize that you now go to the bank. Every time your mother or your dad calls you, I've forgotten my banking PIN number. They go into the banking hall. They can't remember their bank details. They can't remember their bank account numbers. And these are people who used to be bankers. They're people who used to be mathematicians, accountants, auditors. And this was completely out of the ordinary for them. And now it's become the norm. In addition to that, they now forget how to do things like dressing, cooking. They begin to engage in behavior that could be detrimental to their own health and also to the health of other people in the society. For instance, they will drive, and family members have told me that I sit with my dad in the car or I sit with my mom in the car, and we get to a crossroad and she suddenly cannot remember which is the turning to go home. Where are we supposed to be going from here? They get to a roundabout and they take a wrong route. And sometimes when they get, you all know how traffic is in our countries. So you have all these public vehicles and they get trapped in the middle of public vehicles. We have all these small motorbikes. And when they come and they conglomerate, they simply cannot make an instant decision. They forget which is a brake, which is the accelerator, and they easily cause accidents. So things which were second nature to them or second nature to us, as we all know, you suddenly realize that I used to take for granted that I can drive, that I can go to the bank, that I can cook, that I can feed myself, and now it's a big issue. So these small details now begin to come to the realization of family members. Something else for most of these families that now they begin to realize they need legal support. Why is this so? You find that if your loved one is up country, their next door neighbors or their friends begin to realize that they are forgetful. So they start philandering them of their money, their finances. They will come and ask for money. If your loved one runs a business, for instance, a lot of ladies and gentlemen have been brought to my clinic. They run their own businesses. Their employees begin to realize that they're becoming forgetful. So if they sell something, they'll keep erroneous records. And when the family comes to account for the money, they simply cannot account for where did you lose the money? What happened? You sold items of this amount of money and suddenly you're not getting the returns you used to get before. They don't keep their records anymore. So executive function is affected, frontal function is affected, personality is affected, behavior is affected, spatial distribution, topographical orientation in terms of finding your way, even something as simple as finding your way in your own house. You find that the parent wakes up, wants to go to the bathroom and cannot find their way to the toilet, cannot find their way to the bathroom and ends up in the wrong room. They go to visit their children, houses where they've been so many times, they get lost and they move from room to room. So eventually the family starts to realize there is a problem. And now with the awareness, with all these campaigns, we hear that there's something called dementia. It's time to now go to the doctor. So dementia literally touches on all domains of life and not just memory.
That's incredibly helpful for people to hear this and know that that's not a normal part of aging. Vaibhav, you have your hand raised.
Yeah, I just quickly wanted to say, first of all, Dr. Sylvia, thank you so much for that, incredible description of how dementia can be, detected in people. I just want to say that even for younger folks who may be far away from obvious symptoms of dementia, there is a need to track and understand their brain health, and there are various risk factors that one can track. Simple things like sleep, stress, depression, exposure to certain types of pollutants, heat, etc., and minimize. And now increasingly technologies will be available that can detect even very subtle, decline in cognitive abilities that you may not even perceive. So, for example, there might be apps on the phone that are validated that you can download that track things like how you type into the telephone, right? How much time does it take for you to remember your password? These are things that you will not notice, but these digital apps can notice. And the goal is simply to understand early on, how is your brain doing? How's your brain health? Is there any decline in performance? Can I do something right now to reduce my risk factors? And if things continue to progress, then of course go and see a doctor and a physician, right? So we, I just want to emphasize that we have to take a whole life course approach to this and really start thinking about brain as another organ that you have to take care of, just like you take care of your heart, just like you take care of your eyes, starting very early in life so that you can maintain your cognitive powers for a long period of time.
Now you're getting to some of the things people can do that don't cost anything, meaning eating well, staying fit, exercising, keeping their brain healthy, so that even if there is some pathology, you can fight back by keeping the rest of your brain healthy. So Vaibhav and the Davos Alzheimer's Collaborative have helped us implement tools that are sensitive to even early changes, like your sense of smell. Most people don't think about that, but your sense of smell is actually an area of the brain. And that area is very close to where these Alzheimer's proteins like to gather early on in the disease. And people in Kenya speak multiple languages, are really experts in languages, 2, 3, 4 languages, switching between them fluently, communicating effectively. We can see that start to change. As Vaibhav is pointing out, even in the way people use speech and switch between languages, maybe preferring their earlier languages or relying more on them than languages they learned later in life. So these are all very early signs, even before people get to not being able to drive or not being able to remember their way home, even earlier. The trick is, how do you tell between, what's just a bad day, and sometimes when we go through midlife, if we have stressors, we have a bad day, we're forgetting things, but what's more than that? So then we have this tool, brain imaging, that Jacqueline can tell us more about, where you actually look at pictures of the brain. So we test how the brain functions, but we can look at pictures of the brain. And what can that tell us about dementia, Jacqueline?
Okay, thank you so much, Karen, once again. Dementia is primarily a clinical diagnosis based on the patient's symptoms, medical history, and cognitive assessments. However, that said, brain imaging also plays an important role in supporting these diagnoses, and that's by providing visual evidence of changes in the brain. Imaging will help us to rule out other conditions such as strokes or tumors, which can also mimic dementia symptoms like cognitive impairment. Imaging reveals key structural changes like brain shrinkage or damage in specific areas, and these will help us distinguish between the different types of dementias. There's also another tool, PET imaging, which can help detect abnormal protein deposits, like Dr. Sylvia mentioned, even before significant symptoms appear. And this allows for earlier intervention, hence early diagnosis and early treatment. Unfortunately, in Kenya, access to these imaging services is a major challenge. Many public hospitals will lack MRI or PET scan machines, and private facilities are usually too expensive for families. Unfortunately, even when imaging is available, there is very little training to imaging professionals on what to look for when obtaining the images, or even after you've obtained the images. And as a result, many people will get diagnosed late or misdiagnosed, and these are unfortunately leads to delays in proper care.
So you point out that we don't have that imaging technology available across many settings. And that's where it sounds like some of the tools that Davos Alzheimer's Collaborative are helping us validate could play a role. That even if there's not an MRI scanner in a community health center, that there may be access to certain early detection tools. And that's why we need to think about really an aligned strategy that involves multiple sectors. So I'd really like to call attention to Dr. Edna's work in doing that, bringing different sectors together, and ask how you think we can translate a lot of these things we've discussed, caregiver burden, early detection, into meaningful policy and change, public health change in Kenya and even other, limited resource settings.
Thank you so much, Karen. So our work actually points out to different tiers in our societies that really needs to be strengthened. For example, we can see there's a lot of work that needs to be done at the community in terms of creating awareness and also destigmatizing the perceptions that dementia is a normal part of aging or is associated with witchcraft and so on. So one thing that we've done during the Brain Awareness Week is we've used a simple messaging that communities will understand or that resonates. If people think it's normal part of aging, then we tell them dementia is not normal part of aging. Then we give messages such as eat healthy, exercise, collaborate or, have that association with other peoples as low-hanging fruits for people to start preventing even future risks of dementia. That is one way that we are translating this information or this evidence into practices that aims to, help at population level. But the work also has implications at policy level, because we've seen a lot of things, even from the panelists, people talking about having restraint measures or people not being protected. We don't have protections, especially amongst people who are suffering from dementia. So coming up with policies aims to protect these people. And what this work has contributed to is to come up with a simple policy brief that can be adopted by the government of Kenya and other stakeholders who are really key decision makers, to see that some of the strategies, some of the interventions can be adopted into our systems, into our country. And also there's an implication in health systems. And I think our work underscores that. Dr. Sylvia and Jacqueline have already talked about the gaps we have in terms of equipment, but also in terms of human resource expertise. So this work also actually communicates to the need to really think about curriculum, think about how do we sensitize more doctors, young doctors, to really, get an interest in training around the field of neurology and having the resources or capacities to really support them and to ensure that they are supported so that we can have more neurologists in future. Having 18 neurologists the whole country, that one is not really helpful to most people who don't have the privilege to access these neurologists. And just to mention, these neurologists mostly based in urban centers like Nairobi. So you can imagine people in rural counties in Kenya, they don't have access to these neurologists. So this work communicates to different tiers, just to emphasize that we have a role to play to champion awareness creation, to refine care pathways, to ensure that at least there is early targeting of these disorders at primary healthcare facilities. There's a way they can be worked around, not necessarily to rely on, before people get to neuroimaging, at least let's do some cognitive assessments at primary healthcare facilities. And let's embrace technology, as Dr. Vaibhav has talked about. Thank you.
Well, we're moving into the question and answer portion from the audience. And I have been glimpsing at some of the questions, and there's really just an excellent set of questions. I want to see if we can get through some of them. Someone asks, well, how do we help people with dementia keep their functions for as long as possible? So one mistake people make is thinking that, oh, this person's sick, so they shouldn't do anything, rest their brain. Rest, take it easy, don't do much, right? That's not what we want. We want people, even if they have early signs of dementia, to keep their brain active. If you keep your brain active, you will keep your brain activity for longer. That letting your brain just rest or body rest is going to quicken the progression. That you have to help your loved ones stay active, use their brains, use their bodies, stay fit. And if they have any health conditions, to be very proactive in treating them. High blood pressure, continue to take the medications. If they have diabetes, be very assertive about treating diabetes. That can be important early on to prevent dementia, but in the early stages to be as healthy as possible. Because again, these proteins, these pathology, they're only in certain parts of the brain. The rest of the brain is healthy. We have to keep it healthy to fight back. So it's not enough just to say, okay, now you have dementia, so rest. You have to encourage people to continue to use their functions. They say, well, I'm forgetting things. As Dr. Sylvia pointed out, post-it notes can help. Having more reminders, keeping a notebook, a list of things that they're going to do that day, having a board in the home that is very brightly colored with the calendar, what's happening that day, so they don't have to ask over and over again what's on the agenda. Now we have so many experts on this panel. If other people want to weigh in, I see Dr. Sylvia. Do you have additional suggestions to how to keep people, even with dementia, maintaining their functions for as long as possible?
And these are interactions and dialogues that we have in the clinics with every interaction with family and relatives and patients themselves. And number one, there are acquired causes of dementia or causes that propagate the early development and progression of dementia. And as you said, we have vascular risk factors, we have diabetes, we have hypertension, we have high cholesterol levels, we have sedentary lifestyles, we have obesity, increased substance and drug abuse, which is now becoming the norm, and it's becoming a really big thing out here globally. Increased alcohol addiction, drugs, all these will actually make dementia set in earlier than it would have and progress faster. So we have patients who have primary dementing illnesses like Alzheimer's, frontotemporal, but now they end up getting what we call vascular dementia because there's diabetes, which is affecting our blood vessels, cholesterol deposits, there's high blood pressure, and all this propagates and makes the dementia just progress much faster and even show up much faster. Something else is, I've seen a question on the question and answer session about COVID. Are we seeing more cases of dementia after COVID? I would probably say yes. One of the reasons being, during COVID, there was a lot of restriction in terms of travel and movement. For instance, let me talk about Kenya and Nairobi in particular. We were literally hemmed in. Boundaries were drawn around the city, the urban areas. Children and who are working and living in urban areas could not access their geriatric patients up country. After about 2 years, once the restrictions were lifted, most of the people, workforce, when they went up country to visit their loved ones, they found that their mothers, their fathers had become demented. They had forgotten how to do things for themselves. Reason being, they were completely isolated. There is a reason why human beings are social beings. When you're social, when you're in gatherings, when you're communicating with people and doing things together, you're more likely to retain your memory. And that is why I like what Karen said, that once you develop dementia, a lot of family members, the cue is rest your brain, don't do much, don't do anything for yourselves. No, that is the wrong way to go. Let your loved one do as much as they can do, as safely as they can do it. So provide a safe environment where, for instance, if they love to cook, let them help in the kitchen, let them do things like maybe peeling potatoes, cutting up the tomatoes, and not necessarily putting stuff on the gas cooker. Engage them in reading activities, get them books, let them watch documentaries. Also encourage things like crossword puzzles. Go visit them, enable them to play crossword puzzles, let them do chess games with you, things, Monopoly, that activities that will make them think. If they used to do hobbies before, like for instance, they were knitting, or they used to play squash, or they used to run or do activities that require them to use mental tasking, let them go back to that. A lot of our elderly women, our geriatric women, our mothers used to be very good at crocheting. Get them to start crocheting once again. For those who love dancing, let them join dance clubs. It will make them exercise. It will give them something to do that they will look forward to. It will make them start to remember things about their past that will keep their memory going. Another phenomenon we are seeing, once people begin to retire, retirement is placed at the age of 60, 70. A lot of people start to get depressed. What am I going to do with the rest of my life? I feel like I'm still active. They stop to do things. They go back to their urban, rural areas. They become sedentary. They stop interacting with people. Now dementia starts to set in. But if you keep your brain as active as possible for as long as possible, remember, what you do not use, you will lose. So brain is same. Brain is like a muscle. if you're going to use it, you're going to retain it for as long as possible, stretch its activity. So it's both physical activity, because you know that exercise increases the endorphins, which are natural feel-good hormones, natural painkillers, and which will make you active, increase blood flow to the brain, take away some of the toxins. And then there's also mental tasking, cognitive tasking, playing games and all that. And then take care of vascular risk factors, diabetes, hypertension, cholesterol, limit alcohol consumption, cut out drugs and substance abuse, and also diet and exercise. All these are things that will actually keep your memory going on for as long as possible. And then we have vitamin B12 deficiency, vitamin D, nutritional deficiencies will also lead to subcortical dementias. So all these are things that you can use to keep your memory as active for as long as possible. Diet is very important. Engage a nutritionist. What should you eat? Omega-3, fish. There are berries, red berries, blackberries, blueberries. All these have been shown. Soya to increase your cognitive function. Thanks.
This is so helpful, Sylvia. I think everything you're saying, we're all taking in. And we're reaching the end, and I want to give Zul a chance to speak maybe the last comments we have before we finish with a few more slides to introduce people to ongoing activities. I do want to call attention to one comment that's really important. We want to focus on what we want, not what we don't want. We don't want dementia. What we want is healthy aging. And Nellie Ochieng points out her grandmother died at the age of 104 with perfect memory, crisp, clear mind. She was still bringing truces between feuding relatives in the village. She could remember details, like she had a blueprint in her mind. And she asked, is this an outlier? What I say, no, that's what we want. That's what we're after. Everything we do is to achieve that outcome so that we can all live to be 100 and enjoy our children and our grandchildren and our great-grandchildren. That's what we want. So I appreciate that comment. And the other comments we'll try to address back channel and send them out because there's so many good ones. But I want to make sure we give Professor Zul a chance to speak and close us out before we show a few more slides.
Thank you. Thank you, Karen. And thank you very much. Dr. Sylvia covered exactly what I wanted to say, in that it is not all negative about dementia. What is very exciting is that there was a recent article in a journal called Lancet that talked about modifiable risk factors that Dr. Sylvia was just mentioning. And those are very important things like diet, exercise, social connectedness, substance use, sleep, adequate amount of sleep, vascular risk factors, and so on and so forth. If you address those very early, that dementia, there is evidence to indicate that 40 to 50% of dementia can be prevented. So I think that that's something that we can do now. But the other positive aspect of dementia is now we're at a stage where new drugs are coming out that are able to actually reverse some of the plaques and tangles made by the proteins in the brain that we talked about, the amyloids and tau proteins, that can be reversed. And so that's another positive new forward. So I wanted to say that it's absolutely imperative, as Dr. Karen said, we need to look after our brains and keep it healthy. Keep your brains healthy and happy, because that is one way to avert development of dementia. And the other positive thing is that we have now evidence that we can prevent this, and we actually have a study at the Brain and Mind Institute called Africa Fingers, which is actually going to do a clinical trial by addressing modifiable risk factors to see what are those risk factors in Kenya, and can we avert the development of dementia if we implement those at a community level. So many positive things to think about as well regarding dementia. Thank you.
Thank you. So I think we're bringing this to a close, and I just wanted to call attention to a couple of ways you can get directly involved in our research. So one is to participate in our AD Prevent study. This is a survey. It asks your opinions, your beliefs, your understanding, and what you want to see happen in the dementia space. So we want to hear from you. This is a QR code that you can go to take the survey. It's a research study, so there's a consent form. And then the other thing we want to hear your feedback on is this webinar. We're very interested to know how we can improve our webinars in the future. If you have any helpful comments, we'd love to hear from you. So thank you for your attention. Thank you to our esteemed panelists, everyone